Hi, my name is Susan Onlock. I've been a perinatal nurse involved with breastfeeding women and infants for over 25 years, and more recently I've been involved in educating nurses as well. I created this PowerPoint in the hope that watching it and participating in the internet search described at the end can count toward the continuing breastfeeding education hours required to meet the criteria for baby-friendly status. This article by Ryan and Grace gave me a different perspective on how medical, social, and cultural influences have impacted breastfeeding. I hope you enjoy it. So Ryan and Grace found that infant feeding trends in the 20th century showed that breastfeeding rates were high at the turn of the century, and then they dropped significantly mid-century, and then rose dramatically at the end of the century. And they found that there were statistics on breastfeeding rates, but there was very little research looking into why these swings had occurred. Ryan and Grace, as well as many others, make the point that we need to understand the social context in which we live in order to explain our behavior about a lot of things, certainly in regards to breastfeeding. Some of these influences include historical, cultural, political, institutional, professional, and socioeconomic, and we will briefly consider a few of these. So, historical influences. When Googling for images of historical influences in scientific motherhood, I found myself getting very angry when reading about the arrogance of the professionals who were in charge. But in hindsight, it's easy to find fault. Not so easy to correct mistakes, though. In the late 1800s, the first commercial formula was produced. This would inevitably lead to looking for markets for this formula. As well, medical men began producing texts on infant and childhood diseases, and pediatrics became a specialty. In the early 20th century, there were more hospitals. Women began delivering their babies there rather than in their homes, and this was encouraged by doctors who were also getting into the business of childbirth. As well, an increase in public health initiatives to decrease disease meant that there were more professional and quasi-professionals making home visits and telling women how to improve their hygiene, for instance. We get a sense of cultural influences by considering family customs, art, and popular media, for instance. So breastfeeding was pretty commonplace when artists were painting Madonna images. And yet, in 2012, here's another Madonna pretending to breastfeed in a video to raise this issue in popular culture. This image suggests that we internalize what is normal from a very young age. This child has obviously grown up around breastfeeding mothers and infants because when she's feeding her doll, she's not using a bottle. Social influences are vast and have a huge impact on us. This image from a book cover of a man in a suit advising a new mother, and this image of babies lined up as they would have been in a baby nurseries, suggest a very different infant feeding culture than this image. So, as more women were giving birth in hospitals, they were expected to conform to rules and routines in the interest of hospitals running smoothly. There was increased surveillance of what mothers were doing with their infants. Babies were separated from their mothers and placed in nurseries, and scheduled feedings were the norm. More recently, soothers have become commonplace. More women work outside the home, making breastfeeding more difficult, although at least in Canada we get generous maternity leaves. As well, sexualization of breasts means that many people are uncomfortable with breastfeeding in public. So all of these social developments impact a woman's choices around breastfeeding. Professional influences also impact breastfeeding. For instance, by privileging scientific knowledge, healthcare providers may unwittingly devalue women's experiences and cause them to doubt their mothering instincts when these instincts conflict with what the experts are saying. Before research began disproving this, the biomedical understanding in the middle of the century was that artificial feeding was equivalent to or even an improvement over breastfeeding. More recently, safe sleeping campaigns can also negatively impact breastfeeding, as separating infants and mothers at night can make it more difficult for new mothers who are tired to continue exclusive breastfeeding. Socio-political influences. Now, how can breastfeeding be political? Global health initiatives to eradicate poverty and reduce infant mortality in the late 1970s seemed to be innocent enough, but this would have involved trying to increase breastfeeding rates. And for multinational corporations in the business of making artificial formula, this would affect their profit margins. So a lot of pressure was put on governments to back away from any directions directed at curbing unethical marketing campaigns that promoted formula. As a result, government initiatives to improve breastfeeding rates demonstrated ambivalence and conflict. Here's a quotation from a well-known Canadian, Stephen Lewis, who was the former UNICEF Deputy Executive Director. Those who make claims about infant formula that intentionally undermine women's confidence in breastfeeding are not to be regarded as clever entrepreneurs just doing their job, but as human rights violators of the worst kind. So to get back to Ryan and Grace's article, these authors noted that women's experiences were underrepresented in the academic literature, and that identifying women's concerns creates a better understanding of the issues that impact breastfeeding women. By having a better understanding, this can inform ways to increase and empower women to be successful. And so women's voices need to be part of the breastfeeding knowledge. Their research involved exploring how infant feeding in New Zealand had been impacted by medical knowledge. They interviewed 15 women who had fed 59 infants between 1940 to 1995. This included breast, bottle, and mixed feeders, and a variety of ethnicities and educational backgrounds. They also developed a database of interviews with formula reps, health professionals, advertising copy, policies, and archives to just understand the context in which these women were feeding. Ryan and Grace found that there were 6 categories of women's knowing that were revealed during these interviews. There was instinctive, intuitive knowing, which was articulated mainly in the Middle Era, which I'll get to. There was culturally absorbed knowledge, which is almost unconscious, as we saw in that image of the little girl breastfeeding her doll instead of bottle feeding. There's experiential knowledge, which was the most important source of women's knowing. Shared knowledge, there's strength in learning from and with others. Acquired or taught knowledge, which was mainly biomedical knowledge that was handed down from experts. And there was emotional knowledge, which was never really explored. Ryan and Grace also found that women's knowledge evolved into 3 distinct eras. There was the early era from 1940 to 1965 that was influenced by the belief that formula was as good as or superior to breast milk. And so if breastfeeding was unsuccessful, formula would have been considered a fine alternative. The middle era from 1965 to 1975 was when the disillusioned woman took back their knowledge. And the late era was from 1975 to 1990, when women's knowledge was taken up once again by the experts. In the early era, women complied with medical and authoritarian knowledge. And although the experts knew that breastfed infants had lower mortality and morbidity, this was not really explored. Women felt isolated from other women. And while there was some intuitive and experiential knowledge in this era, it was acquired or taught knowledge handed down from the experts that was prevalent. And this had disastrous consequences for breastfeeding. The middle era, I think this is Buffy St. Marie on a Sesame Street episode. The middle era coincided with the women's health movement. Women were dissatisfied with the dominant biomedical discourse around childbirth and feeding, and so they resurrected knowledge that was informed by their experience. Lay support groups became popular, such as the Leche League, and there was more emphasis on intuitive, shared, and experiential knowledge. In the late era, increased interest in breastfeeding and women's social activism caused an increase in research into the benefits of breastfeeding. Women used technical sounding language to help legitimize breastfeeding in the eyes of scientists, and so women's experiential knowledge was then merged with the scientific research. And this is what Ryan and Grace called the period of remedicalization, in which women's knowledge was taken up by professionals who once again became the experts. During this period, women were happy to have their knowledge taken up by professionals. As new research legitimized breastfeeding in scientific terms, this led to a narrower focus on a problem-solving approach. So, for instance, engorgement that might have resolved with increased feeding in the Middle Era became mastitis, requiring antibiotics or even early weaning. The authors also touch on the impact of lactation consultants. This profession came about in the 1990s with the increased interest in breastfeeding and was developed in conjunction with medicine, so again, more expert knowledge. Ryan and Grace suggest that, even with the best of intentions, deferring to lactation consultants puts women in a subordinate position again. And I also think that nurses who work with breastfeeding infants and mothers need to be careful about always consulting the experts, because this can prevent the nurses from developing their own knowledge about how to support women who are having challenges. I don't mean to discredit lactation consultants for 1 second. In my experience, they're very knowledgeable and respectful of mothers and babies, but this is a point that is raised by Ryan and Grace. And now, if we go back to the ways of knowing discussed earlier, Ryan and Grace discuss how women's emotional knowledge was never really allowed to become part of the accepted breastfeeding knowledge. Because biomedical knowledge was considered to be more legitimate, as it is today, women downplayed the emotional aspects around breastfeeding in order to get the medical experts to buy in. And this minimizes women's experiences. Emotional knowledge around breastfeeding is still not very well articulated today, although with more qualitative research and online forums that are available to women, this is changing. Ryan and Grace raised the possibility that women might have been able to legitimize this emotional knowledge in the middle period if they had not been so willing to relinquish their knowing to the scientists. According to Ryan and Grace, the women of the middle and late periods felt that a focus on emotional aspects of breastfeeding would not have gained credibility in the biomedical domain, and it probably seemed like quite a victory to have achieved as much as they did in such a short period of time. And so, emotional knowledge relating to pleasurable aspects of breastfeeding that may lead to long-term nursing, and also the grief that women experience over their inability to breastfeed, have not yet become part of the breastfeeding discourse. There were a few takeaway messages from this article. One is that when women can talk about and act upon their experiences, they are more satisfied, more confident, and have better outcomes. Another way of thinking about this is that emotional experience is key to breastfeeding success. And so, providing women and baby-centered care that's sensitive to individual families' needs can go a long way to ensuring that women will get the kind of support that they need. It's too easy for care providers to take charge and be the experts when women are starting out on their breastfeeding journey, but we can serve them better by being sensitive to their needs rather than following our agendas. Thanks a lot for watching this presentation. For an interesting learning activity, I recommend doing a Google search for scientific motherhood and images, or feminism and breastfeeding, or scientific motherhood and breastfeeding. When you ask for images, you get some very interesting visual input. You'll get academic articles, newspaper stories, etc. So browse through some of these articles and stories that you find and consider the ways that medical influences have permeated parenting and infant feeding cultures and influence the decisions that women make around how they're going to feed their children.